For me, the apple never left the tree. My father's a psychiatrist, my two older brothers are psychiatrists, and my stepmom is a psychiatric nurse practitioner, creating a long-term impact on someone's life. And I went to med school in India. I had a patient that was 14 years old. It was her first manic episode, and being in India, mental health is not something that was really prioritized and kind of like a taboo. And so we had this patient, first manic episode, got her on the right medication, and 4 years later, when I was finishing up my kind of housey, which is basically a year of internship, this patient came back to our unit and was handing out sweets. And in our culture, a lot of times with this is celebrating something. And so she was celebrating that she got into law school. And one of the things that kind of clicked the light bulb for myself is you're changing someone's life trajectory. When someone has a mental health issue or someone has something going on mental health related, if you catch this early enough, if you can recognize this early enough and you can implement intervention, you can really change someone's life course. There's nothing more than impactful than someone's life trajectory going to a higher place than when it was before. As I wrote in my personal statement for residency, we're making people better than 100%, kind of like superheroes. Just because I'm the psychiatrist, I don't make all the decisions. We are all very equal here. Everyone has their expertise. Everyone is getting patient contact and understanding aspects of the patient differently at times, and getting tidbits that you may not. Getting a different viewpoint or avenue on how someone is seeing the patient, whether it be the primary therapist, whether it be an interaction from nursing, whether it be an interaction from one of the program therapists. Being able to provide that insight so that it helps make the best clinical decision collaboratively is extremely vital. I think it's really a big reason of why I think ERC, Pathlight, we have a lot of success stories with our patients. So I think that collaboration is one of the best things about being in this level of care. My boss or the director, the people above me, they've been so supportive from day one. It's very hard to find a place that accepts you for who you are, and then also make sure to keep the things that you find valuable about not only work but your home life. They prioritize that with you. So I think that I'm very blessed to be able to be part of this organization. Starting at this being my first job as an attending psychiatrist, one of the things that I didn't see within myself was being more of a leader. I've always been someone where, point me in the direction, tell me the things you need me to do, man, and I'm going to do it 150,000%. But I think one thing that's come with this role is, navigating others, navigating how to be a leader, how to be how to coach, how to make sure that I'm not only growing within myself in terms of my knowledge base, but how am I helping others grow in their roles. I'm not a therapist by training. I've gone through some therapy training, but man, I love talking about, different types of modalities, how I would implement CBT, how I would discuss RODBT, how this could be relevant in, certain people's cases, and having those discussions with my primary therapist or a program therapist. Becoming a leader in different avenues within this role has been really helpful for me, and I think is going to be helpful for me inside and outside of my professional life. I'm very grateful that that's something that ERC has expected of me, which was scary at first, but I'm glad that they had that expectation. So many of my patients and people that we encounter, in this profession, we really want to help them understand that it's okay to struggle. How do you identify what leads to your struggles? When you walk out of here, are you more capable of managing what causes struggle for yourself? I don't think that any person is going to live life in a sense that they're not going to have distress, or they're not going to, have some struggle in some way, but do they have the knowledge, the advice, the guidance of what leads to that for themselves, so that they can navigate it. The most gratifying thing is when I know a patient sits in my office after being in treatment that, "Doc, I really feel like I know myself better." That gives me an idea that they really have made some change and are willing to continue to work towards it.